Quick note: this is an automated educational summary of public medical sources. Mayo Clinic, the NIH, and MedlinePlus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. In 2026, more people are checking their inflammation levels without waiting months for a doctor's appointment. But here's what actually matters. Inflammation markers show up in blood tests, and according to Mayo Clinic, tracking chronic inflammation is increasingly important for understanding metabolic health. The question is, what does testing actually cost? How does it work? And can you really order it online without a doctor? We're breaking down exactly what the latest research says. MedlinePlus defines inflammation markers as proteins in your blood that increase when your body is mounting an inflammatory response. The most common one is C-reactive protein, or CRP. The NIH notes that high-sensitivity CRP tests can detect even small amounts of inflammation linked to cardiovascular and metabolic health. These aren't diagnostic tests, they're tracking tools. Think of them as markers your clinician uses to understand your overall health picture, not a diagnosis by themselves. According to Cleveland Clinic, the most tested markers are high-sensitivity CRP, which tracks general inflammation, homocysteine, linked to cardiovascular health, and fibrinogen, which relates to clotting and inflammation. Some labs also offer ESR, the erythrocyte sedimentation rate. Each marker tells a slightly different story. CRP is the most common because it's sensitive enough to catch low-level inflammation, which is why it's become a standard panel. Most online labs test CRP as the primary marker, sometimes bundled with others. Here's the honest breakdown. A single CRP test runs between $40 and $80 through major online labs like Quest and LabCorp. If you add a full inflammation panel, CRP plus homocysteine, fibrinogen, and ESR, you're looking at $150 to $250 total. Some newer direct-to-consumer labs undercut that at $90 to $120 for a panel. Without insurance, you're paying cash. With insurance, you'd still need a doctor's order, which is why the online no-visit route appeals to people who want to pay out of pocket and skip the appointment. You order online, get an appointment at a local Quest or LabCorp draw station, show up with your ID and order, and a phlebotomist draws a small blood sample. The whole visit takes 10 minutes. The sample goes to the lab, and results typically arrive online within 1 to 3 business days. Most labs email you a login link to view them. No doctor's interpretation is included in that price, which is why you'll want to review results with a clinician or use the lab's nurse hotline for a quick explanation. Cleveland Clinic notes that proper sample handling is critical for accurate inflammation markers, so using a certified lab is the safest move. The process is straightforward. Visit Quest Diagnostics, LabCorp, or newer platforms like Everlywell or Let's Get Checked. Search for inflammation or CRP panel, add it to your order, pay, and you'll get a draw location near you. No doctor's prescription required. That's the legal gray area. The labs can offer these tests directly to consumers in most states without a physician order because you're buying the service as a consumer, not requesting a medical intervention. However, some states have restrictions. Once you order, you pick your nearest lab location, book online or walk in, get the draw, and check results a few days later. MedlinePlus lists typical CRP reference ranges as under 3 milligrams per liter for low risk. Above 3, and especially above 10, suggests higher inflammation. But, and this is important, a single high result doesn't mean diagnosis. Inflammation markers can spike temporarily from infections, stress, or exercise. The NIH emphasizes that results need context, your age, health history, lifestyle, and sometimes repeated testing. This is exactly why discussing results with a clinician matters. They can tell you whether a reading is concerning, a normal fluctuation, or something to monitor over time. Once you have results, the research suggests a few next moves. First, save your results file. You'll want to compare against future tests. Second, if your CRP or other markers are elevated, that's a conversation to have with your doctor or a registered dietitian, because lifestyle changes like diet, sleep, and exercise directly affect inflammation, according to Mayo Clinic. Third, consider whether follow-up testing makes sense in 3 to 6 months. Some people retest after making changes to see if their markers improved. Online labs give you the data. Your clinician helps you interpret what to do with it. Testing inflammation at home in 2026 is more accessible than ever. You can order online, get results in days, and review them at your own pace. Just remember, these are educational markers, not diagnoses. The institutions covered, Mayo Clinic, the NIH, MedlinePlus, Cleveland Clinic, all emphasize that blood tests are one tool among many for understanding your health. The real value comes when you use that data to start a conversation with a healthcare provider about what it means for you. If this helped you understand inflammation testing, hit that subscribe button and turn on notifications so you don't miss our next video. What type of health tests are you interested in? Comment below and we will make a video about it.